Well, good evening. I am so glad that you have joined us this evening. My name is Russ Peterman. I'm the senior minister here at University Christian Church, and I am so thankful for your willingness to come be a part of this tonight. Um, in the midst of these crazy, uncertain times, there seems to be a lot of information that is flying out there. There seems to be a lot of misinformation that seems to be flying out there as well. And so I thought that this would be a great opportunity for us as a congregation to take some time and to rely on some of the wisdom of some folks in our congregation. We have just an incredibly deep pool of wisdom and wonderful folks. And so I thought that we would be able to rely on some of their insights and their wisdom and how they're dealing with this difficult situation. I want to let you know that we have had a lot of good questions that have come in already, but I understand that there may be some more out there that you haven't had a chance to ask. There should be on your screen there a Q&A function down at the bottom. If there's a question that you want to ask, you can use that function and it will come to me. And we will try to get to, we're going to try and get to as many of these questions as we can. We recognize that there are some that, well, frankly, don't have answers, but we're going to do the very best that we can to ask that question. Oh, I just got a note that the Q&A is not there, and so please use the chat. Use the chat function down at the bottom, and we will see the questions there, and that will be the best way to do that. So I'm going to open us in prayer, and then we're going to launch right into hearing from our panelists. So will you join with me in prayer, please? Gracious and loving God, in these crazy and uncertain times, we want to pause and be faithful to the information, to the science, to the wisdom that is all around us. And so we seek your presence, oh God, and ask that you help us navigate these uncharted waters, that you give us calm hearts, peaceful minds, and that you give us the willingness to act on not just our best interest, but on the best interest of our congregation and our community and our world. Bless our time together, oh God, with gratitude for these incredible folks that have joined us tonight. And we pray this in your holy and sacred name. Amen. So unfortunately, I want to start with some bad news, and that is that Mayor Price had a personal situation that arose late this afternoon, and she is not able to join us tonight. And I'm sorry about that. I'm disappointed, just like you are. But that said, we still have some incredible doctors and some folks that are on the front lines and dealing with this in a very real way. And so we're going to rely on their wisdom as well. As I joked with them before we started, in some ways, this whole thing has become politicized in ways that some of us can't understand. So maybe this is our way of try to depoliticizing this situation as best that we can. And so we're going to rely on the doctors and their wisdom tonight. So what I'm going to do first is I'm going to introduce each and every one of them, and they are going to talk for just a couple of minutes about who they are and their role, not just in that they do for a living, but also their role here in the congregation, so you can find out a little bit about them. And I'm going to start with Dr. Sue Bailey. Dr. Bailey, will you talk to us tonight?
Thank you so much for having me, Russ, and thank you for having this program for everyone. I am so proud to be a member of UCC, a church that values its members and science so much. I have a very unique role this year. I'm an allergist in private practice and have been here for over 30 years, but this year I'm president of the American Medical Association. And so I am seeing COVID-19 from a 30,000 foot level. I'm spending most of my time doing, webinars like this, but media appearances, television, radio, print media, trying to educate folks about what's going on with the pandemic, how they can best take care of themselves. It's still wearing a mask, washing your hands, and keeping your distance. And so I have not been on the front lines. I may have been on the front page, but I haven't been on the front lines. But it's an honor to be here.
Thank you, Dr. Bailey. We saw you not too long ago on, I think it was MSNBC or CNN or one of those.
NBC.
And I said, hey, that's one of ours. So I was thrilled to do that. Next is Dr. Stuart McDonald. Dr. McDonald?
Yes, thank you, Russ. I appreciate the opportunity to be here and visit with everybody, and honored to be on a panel with my good friend Sue Bailey and some other good friends, but really appreciate what you're doing, Sue. I've been a member of the church since I moved back since in '93 and involved in a lot of leadership roles, and thankfully now I'm just a pew sitter. I work at Harris Texas Health Fort Worth downtown, which is the largest hospital in the community. I'm a pulmonary critical care doc, so I see firsthand. We have the one unit designated for COVID patients and other overflow units. So I'm involved mostly in the ICU aspect. And as my sister Cheryl will tell you in a little bit, she's involved in the floor aspect. So we have a pretty good perspective of what's going on clinically. So happy to be here, and thanks for inviting me.
Thank you, Dr. McDonald. So you teed it up for your sister, the other Dr. McDonald. So Cheryl?
Thank you. Thank you. Yeah, thank you, Russ, for pulling this together. This is, I think, a great opportunity, and so we're always happy to sort of be here to share some of our insights. So, yeah, I've been a member of UCC since we moved back to Fort Worth in '98, and I'm a member of the Koinonia class. Have been, I guess, past chair of outreach, and am currently past chair of the elders, so that's my church involvement. So as Stuart said, so I'm an infectious disease physician in practice, and I'm largely at Harris Fort Worth, the same hospital, the largest hospital in Fort Worth. So we've been involved in a lot of hands-on patient care, and a lot of the sort of strategy and planning at the hospital level, as well as, in our outpatient practice. So.
Great. Thank you so much. Dr. Alice Phillips is up next.
Hi, everyone. So glad to be here. So in my professional role, I am a primary care physician with Cook Children's, and my office has remained open throughout the pandemic time. I'm also in the unique position with Cook that I serve on the COVID task force for ambulatory care there, so have had some insight into a lot of the process and planning into maintaining our offices, making sure that our staff and our physicians are safe, and that we can continue to provide care for all of the kids in our community. In my church role, I have also served on the reopening task force to help guide leadership at the church on how we can do those same things, keep our staff safe, and guide the congregation through this challenging time. So a couple of different roles.
Great, thank you, Dr. Phillips. And last but certainly not least is Dr. Elizabeth Jones.
Hi, my name's Elizabeth Jones, and I've been a member of UCC my entire life. I was baptized in the, they called it pastor's class then, in the 6th grade, and so I'm really thrilled to be here. In my professional role, I am a private practice licensed professional counselor, and I've worked in that area in different settings for about 25 years, and I work with children, adolescents, and their families. So during this time, since March, I've been working virtually. Primarily, I have seen a few in-person sessions, but most of my colleagues are working virtually. And so that's been a new adventure, but it's also allowed me to meet with lots of families every week who are also at home and coping with the emotional aspects of COVID-19. So thank you for having me.
Great, thank you so much. Thank you so much. So we're going to jump right into our questions. We have had several really great questions submitted, and we've got some others that will be coming in along the way. But I'm going to start with just going to kind of toss out a softball here to the group. And I have heard that this is something that the media is simply overhyping, that it's just sensationalizing. And then I've also heard that it is the greatest health crisis that any of us have ever seen in our generation, in our lifetimes. And so I'm just going to toss this out to any of you, to all of you. What is it? Is it something that's the media sensation, or the greatest health crisis, humanitarian crisis that any of us have ever known?
I'm going to let the doctors that actually take care of the really, really sick COVID patients answer that question.
Well, I think you don't want to demean people that don't see this as a crisis, because a lot of it depends on your perspective. And there are plenty of people that don't know anybody perhaps that has COVID, or don't see the devastating impact. But certainly we have seen not just the numbers that you read about, but the personal impact on patients and their families in all age ranges that are ill with this. And I think the scary thing about this is how rapidly and silently it spreads. So there's some questions I think that'll address this a little bit more later, but right now I think it is not hyperbole to say that this is a very, very serious threat.
Great, thank you. So we have a question that came in today. We've seen the pressure that some parents are putting on state and county and school districts to reopen. And I know the Fort Worth ISD just came out today with their new plan of how and when to open. And I understand this person says that there are similar pressure being put on nursing care facilities to reopen to visitors. Do we think it's too early for that as well? Or is that something that we can do sometime soon?
Well, that's a loaded two questions. I'll take the nursing home and leave Alice to answer the school. Nursing homes, as you know, around the country are a source of outbreaks, and it didn't take us long in our screening of ER patients to realize that anybody that came from a nursing home, we treated as a COVID patient until they proved otherwise. And because of that, and they didn't get it in the nursing home, they got it because healthcare workers came in and brought it to them. Unfortunately, those are a vulnerable population, age demographics, pre-existing conditions. And so visitors bringing it in, even if they're asymptomatic, are very problematic. And I know it's hard not to see loved ones, except perhaps through a window, but right now is definitely not the time to open up to widespread visitation to a nursing home.
And then the school question, that is a very challenging one, because you're weighing a lot of issues when you think about opening the schools. Yes, the children in general do very well with this illness. The risk is not zero, though. We cannot say that. And so there is inherent risk to the kids. You have to take each individual child's personal health history into consideration. Their home, do they have high-risk family members at home or grandparents? And then you have to also consider the risk that the kids could transmit the illness to the staff or the teachers. And so that level of complexity is why I think we've seen the school districts struggling with what the right decision is. This is probably one of the most common questions I get within my clinic right now. Dr. Phillips, what do you think? Should we go back? And I have those conversations on an individual level, because it's really hard to make a one policy fits all. And I think that's why we're seeing the challenges the schools are facing.
Great. Thank you. There are several questions about reporting. For instance, how can you find how many COVID cases are in Fort Worth, and how can you find it by zip code, for instance? How can we find that?
So I'll take that. I mean, I think there are several websites that are, Tarrant County Public Health has a website that has Tarrant County statistics that's regularly updated. And you can go to just Tarrant County Public Health and sort of Google around, and you'll get to the areas where they have the different statistics. I think there were other questions just sort of asking about, I don't know if they do zip codes, but the other two, I think, websites that are super helpful and can give you all of the data you want, like per capita. Some questions were, how do we see the numbers based by population? Johns Hopkins has a website they've had since the very beginning that tracks the COVID data and is updated every single day. And the CDC has a COVID tracker part as well. And one of those, I think the CDC one, the CDC COVID tracker actually does by population. So you can click on like Wyoming and see how many cases by population, and the same thing for each state, which I think helps clear up some of that numbers issues that people were wondering about. So
The Johns Hopkins website is really rich, and you can look at just about any statistic you want. I saw fatality rate, just the absolute numbers by counties. I bet I don't know if they go down to zip code, but I do think the CDC website does. And it's interesting to look at that, county by county, zip code by zip code information. And it really shows that cases are clustered in the parts of town that are the most disadvantaged, and especially among minority populations. It's really pretty stunning how COVID doesn't discriminate. Anybody can get it, but there's no question that people of color have suffered disproportionately.
And I'm just going to piggyback, this is a little off, but to what Sue said, which is we have in particular at Harris seen just an incredible amount of Latinos with COVID. I think in New York it was reported African American, and we definitely see that, but I think we have just, it's been stunning the extent to which, and multiple family members in different rooms visiting, when they get better, really, really devastating. So.
I'll tag on. One of the questions I saw in the list was someone was asking about how many children in Tarrant County have been diagnosed. And that's a tricky piece of data to analyze because testing within the pediatric population has been very limited until recently. Since the kids do so well, we as pediatricians, we intentionally were not testing because we wanted to save those tests for the adult population who had significantly higher risk. We were considered tier 3 in distribution of those tests. Now we have pretty readily available testing now. And so, we do have some data, but it's just, I don't think it really is representative of potentially how many children could have had it.
So I'm going to piggyback on that. There are several questions about testing, about how easy it is to get a test, how reliable some of the quicker 15-minute tests are. So we would love to hear some thoughts on those.
I'll start on that one, then others can jump in. There are still a shortage of testing material, and it's really more difficult than it should be to get a test, unless you're sick in the hospital. The gold standard test is the one that you've seen on TV where that looks like they stick a Q-tip all the way to the back of your head. And they practically do, because they really need to get back to the throat to get the secretions they need to test. That actually looks for the presence of the virus, and that's the most accurate test. That can take a while to come back. The rapid tests, I think, very often need to be confirmed with the Q-tip test, as I call it. And the antibody test, which is a blood test that measures your immune response, totally different animal. And unfortunately, that we don't have enough information yet to know how you get immunity to COVID-19, how long it lasts, and what the numbers on the antibody tests mean. So right now, you can't use an antibody test to say, okay, I can go back to work or I can go back to school. The best use for the antibody test is if you've had COVID, and I'd love to hear Dr. Cheryl's opinion on this, to see if you're a candidate to donate plasma to others who've had it, to use your protective antibodies, or as part of community surveillance, just to see how much of it's in the community. But in terms of individually, am I immune? We don't know yet.
Yeah, I agree. I would say, what I would say about the rapid test is if it's positive, that's valid. And so we will accept a positive 15-minute test, but they miss more people. So you might have a negative, but still have it. So at Harris, we'll do the rapid test. And if it's a negative, but we're still suspicious, then we repeat with the more sensitive test, which takes a little bit longer. And I agree. One of the things that we started doing at Harris is when our patients are discharged, we give them the information for how to donate plasma as they recover. And anybody who, I think that Carter wants confirmation that they had the illness in addition to the antibody, but I'm not sure if they've changed that, so that they would need to not just have antibody, but have had the confirmation that they had the illness before that. But definitely there's a need. There are times where even a couple of weeks ago, we had to wait 2 or 3 days to get plasma for people because there was a backlog. Now it seems to be opening back up again. So we're always encouraging that. That is one of the treatments that we think may be helpful to people in the hospital, is that convalescent plasma.
Fascinating. Thank you. So along the same line, and this one might be for you as well, Cheryl, if the coronavirus antibodies may or may not offer long-term immunity, how would a vaccine help?
Yeah, great question. I mean, these are all the questions that I think people have, and we don't know. Like, as Sue said, we don't know how long that our personal immunity. So if I get the infection and then my antibody goes away in 3 months, which we're seeing in some people, does that mean I'm vulnerable again to it? We don't know. Maybe you still have immunity. We're just not measuring it in the lab tests. We don't have a good understanding of that. It just hasn't been around long enough for people to get re-exposed and figure that out. We're assuming that the vaccine will provide immunity, but again, the immune system is very complex. Sue can probably speak more to this, and there are lots of different facets of it. We're trying to design vaccines that will stimulate certain types of immunity. We hope they're the right ones. A lot of this is just using the best science and trying to figure out what we know from related coronaviruses, and trying to design the best. So as I know y'all are aware, there are lots of vaccines in development, and I guess time will tell. That's all we can do.
Let me add to that. There was another question about volunteering to be in the vaccine trials. The vaccine trials started this week, and you can go to coronaviruspreventionnetwork.org, coronaviruspreventionnetwork.org, if you're interested in volunteering. And that's what these large, we call them phase 3 trials, are designed to do. Half the people get, placebo, half the people get the vaccine, and then we wait and see how many of them actually get sick. If the vaccine works, it'll be pretty obvious. If it doesn't work, that sadly will be pretty obvious too. And there's lots of different kinds of vaccines, including some that we really have not used before, using RNA and DNA and some fancy stuff like that. So, but if you're interested in participating in a trial, we need all ages, we need men and women. We really need to have a very diverse population in these vaccine trials so they'll be valid.
Excellent. Anybody else want to add to anything to that? Excellent. So there are some questions too about transmission and the severity of cases and all that sort of thing. So I'm just going to read this question. Does the severity of the case correlate with the amount of virus you are exposed to?
I think we all feel that's a significant factor. I mean, there's obviously some people that are exposed and are asymptomatic, and you wonder why. There's probably two factors here. I think very significant is the amount of the amount of virus you're exposed to, the viral load. So if someone coughs in your face, you're going to get a whole lot more than if they're wearing a mask, and the mask contains a lot of that. Obviously, the other factor is your underlying immune system, your vulnerability because of other medical problems. And both of those, I think, are critical in whether or not you get sick or you're just an asymptomatic carrier, which can spread it to other people.
But Stuart, isn't that one reason why we think that so many healthcare providers have gotten sick is because the viral load that they get is so high?
Definitely.
Yeah, but I would also say, I think that's been less of an issue here for us. I mean, I think we watched that happen in Italy and we watched that happen in New York. And the big difference is I think we're still frustrated with the testing situation, and treatments are not as far along as we'd like. But we have had adequate PPE from day one here in Fort Worth, Texas. Every hospital does it differently, but because I cover a bunch of them, I have never felt unsafe. And I think that's a big difference from what they experienced in New York, where they just didn't have the time to prepare and rapidly got overwhelmed. The shutdown allowed us to not rapidly get overwhelmed. So now that the numbers have gone back up, we sort of have a better sense of what we're doing, and we've never had the PPE problems. So in Fort Worth, at least at Harris, most of the healthcare providers that have gotten sick have actually gotten it in the community, not at work. And I think that's important to recognize.
Great, thank you. So there's another question about how long people are contagious with COVID-19. When are people with coronavirus the most contagious?
I mean, I feel like I'm talking a lot. So people we think are contagious for probably about 10 days after their symptoms come on, if they have symptoms, and they may be, some people are contagious for a couple of days before that. So we know that people are secreting virus maybe for a day or two before they develop symptoms and are contagious. And that's one of the problems, is they don't know they have it. And if they're not wearing a mask or providing any sort of protection, then they can transmit it to other people. And then there's also, I'm sure y'all have heard this weird thing in coronavirus where there are these occasional super spreaders. And I don't think we really understand that, but those people, like the choir situation in Washington, where there was a super spreader in the choir who, and of course singing is you expel a lot of secretions, but so that kind of complicates it too. We don't really understand that. Maybe they have super high viral loads. And then after you get sick, then after about 10 days, it does not appear that most people are contagious any longer. So one of the things we've gotten away from is the retesting of people to clear them, to say they're not contagious, because there's pretty good information that if people are about 10 days out, they're no longer able to give the infection to somebody else.
So along those lines, Geraldine Deerdorf submitted a great question. Why do you think COVID-19 has spread so rapidly and thoroughly penetrated our communities as compared to other viruses like the SARS epidemic of 2003 and the MERS outbreak of 2012?
Yeah, that's a great question. And one of the things that I remember when the SARS epidemic came out and we had all these meetings at the hospital preparing for just what is happening now, and it really never materialized. The difference is those viruses didn't have a long asymptomatic period. There weren't a lot of asymptomatic carriers. You knew when they were sick. They were coughing just like somebody with the flu. You stayed away from them, and you could contact trace much more easily because you knew somebody was sick when they got symptoms. You told everybody, found out everybody they'd been around. Now you have somebody that might have been carrying this transmitting it and not even knowing it. And that makes it really difficult to go back and trace, well, who have you been around in the last 10 to 14 days? And it makes it spread a lot more without people even being aware of it. So that's the biggest difference.
So along those lines, in terms of transmission, there are several questions about how to protect yourself. For instance, if, especially as we get into the summer months and folks are wanting to travel, is it safer to fly or to drive and stay in a hotel?
I think it's definitely safer to drive and stay in a hotel or camp or bring a trailer would be the best situation. It's, at the worst situation that you can be in to get coronavirus is in a small contained area where you're really, really close to people. And that's what airplanes are like now, even though some of them are spreading them out more and making sure that everybody wears masks. I know that I'm not ready to go on a plane yet. And so I'd love to hear the others' thoughts, but I'd much rather go in a car if I go anywhere.
I totally agree. I think exactly what you said. My biggest concern is people in enclosed spaces with air recirculating, spreading the virus, and a plane is a perfect scenario. Even though they talk about their filters and in the system, I would much rather be driving in a car. I'm not worried about going in a hotel as long as you're in a mask and you're staying away from people as much as possible.
Anybody else?
I agree. I mean, I will say I have flown sort of in a situation where I needed to fly and just timing wise, but I have access to N95 masks and I feel really secure in those. When I talk about PPE, those are the ones I wear in patients' rooms all day long. And so they're not super comfortable, but I think they work. And so so that kind of was an added level of security from my standpoint. But I would prefer to drive. I think, for sure driving is safer if you're able to do that.
So there are other questions.
I agree with the other docs, and I think you can even expand upon that to what activities are safe. I think any activity where you're inside in an enclosed environment with a large amount of people is not safe. So to kind of carry that forward, I'm comfortable eating on an outside patio, but I am not comfortable eating inside of a restaurant just yet.
So there was a question too about the safety of public restrooms. How would you like to weigh in on that?
Well, I really don't think a public restroom is necessarily any more dangerous than any other enclosed space. For one thing, you get to wash your hands right away, and that's real important to do. There was some concern about the modes of transmission of coronavirus. There was one question is that, we hear that it can be spread through the gastrointestinal tract. And we think that might be true, but we don't think that's the primary mode of transition. That just may be where, the secretions that you swallow eventually go out the other way. So public restrooms, as long as you're, wearing your mask and washing your hands, I think you're fine.
So to piggyback on that, there was another question that came in, and I'm not going to identify the author and the asker of this question because this person started by saying, "I'm almost embarrassed to ask this, but this is my chance." And the question is that she had heard, or he, I'm not going to say who it was, he or she had heard that the COVID-19 virus is found in bowel movements of folks that have had the virus, and that it can be traced through the sewer system prior to the community having other types of symptoms. Is this a real thing?
It may be a real thing, but I'm not sure it's one to be concerned about. We have incredible sewer systems and sanitation systems in our community. And so I just don't think that's a concern at all. What do y'all think?
I agree.
Yeah, I agree. I mean, I think one of the tricky things is that the way that we detect virus with our tests really just detects part of the RNA part of the virus. And that doesn't necessarily mean that that's live contagious virus. And so being able to measure it in the sewer system may well just be remnants of what they've shed, as Sue said, when they swallowed it or in their secretions or whatever. It's hard. So we don't have good evidence that transmits into being contagious at all.
So my doctorate is in ministry, not in medicine, but I'm going to weigh in on this question just simply because I was on a webinar not too long ago with my daughter's University of Colorado, and they mentioned that they are going to be monitoring the sewage output of some of the dorms as a way to kind of trace that to happen, which sounded like a really crappy job to me, but. Anyway, I'm just going to leave that one right there. We had a couple questions that have come in. This one is for Dr. Jones. And what can we do as parents to reassure our children during this time of uncertainty?
Well, that's a big question. I think when I think about the anxiety during this time, one of the things I've thought about is that most of my career I have tried to help children with anxiety about imagined or perceived threats and not real threats. And this is really the first time in many of our lives, and in fact, and certainly for our children, that they have a real threat, that it could be a harm to their body, which is our brain is responding appropriately if we're anxious. So that's what our amygdala is supposed to do. That's the way your brain is supposed to work. So one thing is maybe to help acknowledge that and to teach children that, to say, sure, you're worried about this. This is something that is serious. But when you worry, that's our body's warning system. And it warns us so that we can be cautious and we can be careful. So what can you do to be careful? You can wash your hands. You can wear your mask. You can use airplane hands to stay 6 feet apart. These I'm thinking about young children. And so helping them to understand that anxiety serves a purpose, and it's a healthy thing for that to happen when there's something that could be dangerous or scary. The other thing is lots of structure and self-care for children. I think any kind of structure we can still have in our homes, no matter how old our children are, whether it's dinner on the table on Sunday night, whether it's sitting and watching church on Sunday morning, or reading 3 books at night to a first grader, whatever your routine is, to try to keep some of that in place so that they have that structure. And the last thing I thought of is just good self-care, as far as helping kids to learn, well, in these moments when we're at home, what could you do with your body and your brain that would be good for it? Does that mean that we take a walk? Do we sit and pet the dog for a while? Do we paint with watercolors? Do you learn how to, I talked to a child yesterday that said she's learned how to bake every kind of cookie through the Betty Crocker cookie book. And that's a great thing to do. And so these are some of the things I think we can help kids to acknowledge their stress, and then help redirect them to good, healthy self-care.
That's an excellent answer, and probably some good advice for all of us in that. Along those same lines, while you're teed up and talking, one question was, my teenagers aren't taking this very seriously. What advice do you have for that?
I read that question. I thought, I hope we don't get that far on the list, because this is my first pandemic too. And so this is a tough one. And I have young adults at home, and I had a couple of thoughts. This is not really a perfect answer, but of course teenagers are going to push back because they are wired to do that. And they're going to push back against authority, which is usually the parents, because again, every cell in their body is trying to push for independence. So part of that is completely normal. And, but it's just magnified because of the gravity of the situation. I do want to say that many of the children I talk to, because I'm talking to them without their parents, so they're not in that power struggle, they do know the right thing. And I've really been inspired by a lot of kids who've seen this as a moment for them. I had a child tell me this week, I know I'm living history right now. And I think we have a responsibility. And that's amazing for a 16-year-old. So I do think we can call on their higher selves to do the right thing for the community. But in reality, that does mean that there's probably going to be some risks that teenagers are going to take in order to meet their developmental needs. They may figure out what to brainstorm and problem solve with them about, I know you need to see your friends. How could we do that safely? How could you gather outside? Where could you wear a mask? Could you come to our backyard instead of going to an indoor space like a restaurant or something like that? So I think helping to acknowledge their developmental need to be with peers, which I'm guessing is where that question is coming from. That's usually the typical thing. And then helping to problem solve with them in a way that meets everyone's needs.
Excellent. So while on the subject of our younger generation, this question is for Dr. Phillips. What is your opinion on school opening decisions being made now? For instance, hybrid versus all remote option for the start of school.
So we kind of touched on that a little bit earlier, and I certainly don't want to step on the wisdom of the folks making those decisions, because I do think they're hard decisions that have to have a lot of considerations to them. And so as an individual, if I had kids in school, I would be talking to my kids. I would be asking them what their thoughts were. I would assess how my own children learned best. Do they learn best in person? Do they learn best online? What are their social needs? Where are they emotionally? Where are they from a health status? And then try to come to the best decision for my own children individually. I don't think I can really give an answer to what do I think is best. We've never done this before, and we're trying to figure it out. And so I respect that they're really struggling with the decision, because it means they're considering all those aspects.
Great, thank you. Just a follow-up question, sort of, but it not necessarily follow up to that, but while you're talking, Dr. Phillips, we are hearing that most children have a different COVID experience than adults. Do therapeutics act differently as well? And are different therapeutics used to treat children versus adults?
Kids do have a very different course, with the vast majority of them being either asymptomatic or having very mild symptoms. So for the vast majority of our kids, treatment is going to be home care. It's going to be fluids, fever control, and rest, and then quarantining so that they don't inadvertently expose anyone else. Within the hospital, there are some protocols that our infectious disease docs have, and they are somewhat similar. You see some of the same medications being used, but kids are not little adults, as I like to say in pediatrics, and so they do respond very differently. One thing that's really interesting about kids, we were talking earlier about transmission, and there's a lot of early data that suggests that the 10 and under don't really spread it very much. And as I was listening to my colleagues here talk about healthcare workers contracting it, what's very interesting is pediatricians, we're not a lot. I mean, I'm not going to say zero, but we haven't had any patient direct transmissions to any cook, physician, or employee. It's all been community spread. So the 10 and unders, early data seems to suggest that they're sort of viral dead ends. But the 10 to 20-year-olds, that population reacts much more like the adult population in their transmission. And so those are the kids we have to be more cautious with.
Excellent. Thank you. So we've had a couple questions come in. One question from Facebook. Are scleroderma patients more at risk if they get COVID?
I will take an initial stab at that one. Scleroderma is typically not associated with any deficiencies of the immune system, even though it may be autoimmune. However, if the patient is on medications that suppress the immune system to treat the scleroderma, that might put them at greater risk. But guys, what do y'all think about that one?
Yeah, I agree. I think I'd be concerned, if you have any medical condition. I mean, I would be worried about being around someone who potentially had it. I don't think scleroderma is particularly more at risk than anybody with any chronic medical condition, but they are still at risk.
So we have another question for Dr. Jones. Have you worked on or developed anything to help districts, school districts, help children?
I am on a committee with some of these lovely folks here tonight in helping a smaller private school, but not in the school districts. I assume that they have people they're consulting with, and they have counselors and psychologists that work for the district that they're working with.
Great. So a couple other questions that have come in. This one from Bob and Carol Stewart. So if you participate in a phase 3 trial, are you supposed to go out and try to get the virus?
No. They will monitor you very closely, but they want to see what happens in real life. So no, you're not supposed to go hang out in bars. But just live your normal life, and then your daily journals and diaries and things like that to see if maybe they can determine where you might have gotten it if you get it, but don't try to do it on purpose.
Great. So this one question came in. I am 74 years old. I've stayed in. I've ventured out only 10 days or so with masks and gloves. Am I doing the right thing?
Absolutely. And it gets old and people get cabin fever and frustrated, but that's really the key thing. And I mean, to add a little ray of hope, there's no clear data yet, but since the mask ordinance was enacted, we are definitely seeing a downtrend at Harris. And like I said, this is the largest hospital in the county. And for us to now have ICU beds, which I haven't had for months, and it has to be that masks work. So with more people wearing masks, washing hands, and social distancing, it's not sexy, it's not a vaccine, it's not a cure, but it's what's going to keep us under control until we get a vaccine.
Anybody else want to weigh in on that?
I'd like to just add to the mask conversation in general. There were some questions about that, and that's one that I've been getting a lot when I'm, doing media appearances. In the beginning, we did not know how this virus was spread. We did not realize there were a lot of people without symptoms that were capable of spreading the virus. So we did not recommend masks for everybody. And yes, there weren't enough for a lot of healthcare workers, so we were kind of concerned about that. And, parenthetically, I'm really glad the hospitals here are well equipped, but in private practice, it's still hard to find masks that are reasonably priced and not worry about getting fakes or having a reliable source for them. But so we're not recommending that everybody go get an N95 mask. That's probably overkill. But when we realized the primary mode of transmission was through, respiratory droplets, a cloth mask works great. At first we thought, well, it may not protect you, but if you've got it, you won't give it to them. Well, now we know it probably really works both ways. Yes, the pores in a fabric are going to be small enough to admit the virus, but the viruses aren't trying to get through themselves. They're carried on larger droplets that are caught by cloth masks. And so we do recommend that when you go out, everybody should wear a mask every time.
And what about the plastic face shields? That was a question that had come up.
I really think that those should be reserved for healthcare workers or those that are in a position where they're like, and maybe some teachers, but it's not going to work as well by itself as it does with a mask. So I think for people not in a healthcare setting, the use of face shields probably not necessary. Stuart, Cheryl, what do y'all think?
Yeah, I totally agree. It does not replace a mask. That has to be the message.
Yeah, I agree.
So somebody brought up the magic word just a minute ago, vaccine. If you all had a crystal ball, when do you think that we will have a vaccine? And we're going to hold you all to this.
Well, you see, nobody wants to answer. It's, I really don't know. I will be shocked if we have one before the end of the calendar year. These things just take time. They're kind of rushing, the earlier parts of it because they're doing multiple stages at once. But the part that you can't rush is the recruiting the volunteers and people going out and seeing if they get the virus on their own. And so I'll be surprised if we have anything before January.
So a follow-up question to that just came in as you were talking. When the vaccine is available, should we all go out and get it right away?
Probably not. There are committees at the CDC and the National Academy of Medicine that are, there won't be enough for everybody to get one all at the same time. So we're going to have to prioritize to high risk groups first. And we don't know what that prioritization is going to be. Listen to the experts. When it comes closer, those committees are meeting, right now as we speak. We'll know what the priority is. I imagine healthcare workers will be high up. I imagine folks over the age of 65 will be high up. But other than that, we don't know yet.
I'll piggyback on that and say, if I was guessing, I would guess early next year. And if that means we get a safe and effective vaccine, then I am okay with that. One thing that we as pediatricians who deal with vaccination challenges all the time are concerned about is we do not want anything to inadvertently play into the hand of individuals who are against vaccines. So we do not want to lose public trust on this. We want a safe and effective vaccine that prevents the illness, saves lives in a very safe way.
And I would also say that to add on to what Sue mentioned about, I think there's going to be the manufacturing capacity. Even so, my prediction is there'll be multiple vaccines that will become available in early 2021. And because not one company will have the capacity to manufacture what's necessary. And so I think there'll be stratification based on risk, as Sue said, but my guess is there may be multiples that pass through the initial hurdles and will be available. And we'll just get whatever we have access to, kind of like the PPE.
Excellent. Excellent. So I had a question come in about asking for your thoughts on the hydrochloroquine treatment.
Okay. So I think that this is an example of sort of something that I think we are maybe more used to in trying to in medicine, is how things come and go, and something looks good and then a study comes out and it doesn't look so good. And but there's been so much press and scrutiny about different treatments that it's I think it's confused people. So early on, based on some of the previous SARS epidemics and MERS, there was thinking that chloroquine and hydroxychloroquine would have some efficacy, and they were used some in China, and we used them, I think, in the early part of the epidemic. We don't have a lot of treatments available. And then there were early reports released that this might be good, and they were not gold standard type studies. And so Sue described the vaccine trial where half the people get the vaccine, half the people don't. And that's really what we also need for medication studies. Half the people get it, half don't. And then you see what are your endpoints. Do people get better? The ones that got it, did they do better than the ones that didn't? And to this point, and there are ongoing trials, but to this point, all of the studies that have looked rigorously in that randomized and blinded fashion, blinded meaning the investigator doesn't know which one they're getting, so you can't skew your results like, well, I think they got better. None of the randomized blinded placebo trials have shown benefit with hydroxychloroquine. So I think that most of us that are caring for patients in the hospital setting, we don't use it. It's been removed from our algorithm. We don't, and in the beginning we thought maybe it worked, because we were using it, that's all we had, and people get better. But I think people get better from this a lot anyway. And that's why you really need the randomized blinded. Are they just getting better? They would have gotten better anyway, or are they getting better because we intervened with this medication? So at this point on July 30th, we don't think it's beneficial. There are ongoing trials, and that's really what we continue to need. And there are other therapeutics that we're using today that we may not use in 3 months. That's just been the nature of this. None of them have been the slam dunk that we've hoped for, but so that's hydroxychloroquine. I don't know if anybody else wants to piggyback on there.
Anyone? So a question came in. Is there anything outside of just washing our hands and wearing a mask and social distancing that we can do to protect ourselves from the virus? And the follow-up question is, for those of you with high exposure, do you take a daily vitamin or anything additional to boost your immune system?
No, I think, I'm sorry. I'll just say real quickly that I do not, I don't have any concern about getting this virus at work. I'm exposed to the sickest of the sick, but I have a lot of barriers, as Cheryl mentioned, the N95 mask and the shield and, gloves and gowns that I change in a very careful manner. And so I come home, take off my scrubs, take a shower, and that's about the extent of what I do different. I no longer wear nice clothes and a tie to work. I wear scrubs every day, but other than that, no, I don't need any specific immune boosters. It's not really, that's not the issue in my mind. Sue, what were you going to say?
Yeah, I get asked a lot by my patients, well, what can I do to boost my immune system? That's get plenty of exercise, get a good night's sleep, eat a balanced diet. There really aren't any specific supplements or herbs or vitamins or anything like that that necessarily boosts your immune system. So really just taking good care of yourself and doing those common sense things is really the best thing to do.
And I will wrap back around and say that there is an ongoing hydroxychloroquine trial looking at this specific issue. Does it help prevent, I don't know if acquisition, but if you get it, and that's ongoing. So maybe in a few months it will be beneficial in this role, but right now I wouldn't recommend it. I don't do it. I would just the mask. And then my personal life, I don't do anything. I don't go to restaurants. I don't hang around people, it's all of this. It's the social distancing, I think that's unfortunately where we are in this unusual pandemic circumstance.
So I'm not sure who will be able to answer this question, if anyone can, but I'm going to ask it anyway. The U.S. represents 4% of the world's population, yet represents 30% of the cases and has the highest number of deaths. Why have we as a culture, as a nation, had such a hard time with this? And what can we learn from how other countries handled the coronavirus?
Well, I'll take a stab at that one. There's probably 10 different answers to that question. The part of it that I want to focus on is how diverse the United States population is, and how terrible a job we do at controlling chronic disease. There's far too many people in this country that don't have health insurance, and those all put you at higher risk. We also have this incredible independent streak and don't like being told what to do. Many of the societies, the other countries that have done much better, when someone tells them to wear a mask, they wear a mask. When someone tells them to stay home, they stay home. And Americans are a little bit rowdier than that, I guess. But it's, I think that the combination of the diverse population, the maldistribution of healthcare, the prevalence of chronic disease, and kind of our own natural predisposition to be independent.
That was an excellent answer. Anybody else want to add anything to that? The rowdiness of Americans. I'm going to quote that in a sermon sometime, and I'll quote you. So there were some questions about therapeutics. Are there any therapeutics being developed by drug companies? And if so, what are the possibilities of when this might be available?
So yeah, there are a lot. We're actually doing some of those trials at Harris. I think there are two sort of major strategies right now with that when people get infected with COVID, there's the virus, which infects, and the more this goes on, the more we realize it's not just about the lungs, but the lungs is the hardest part of it. And then there's our own body's immune response to it, which is sometimes too exuberant and actually causes problems in its own way because it causes too much inflammation. So there's lots of therapeutics trying to attack both of these, we have an antiviral that's the farthest along and is not formally approved, but has like a FDA emergency authorization use or something. But then there are other antivirals that are in development. And then similarly with ways to try and address this over-inflammatory state. So there's tons in a pipeline. I think when those will be available, they're in phase 3 right now. I think it depends on how quickly they get patients in the trials and get the outcomes. And then, and then the FDA will fast track all of this. There are a lot of rules that there's certainly, the trials are still being conducted safely, but they're allowing things to move more quickly because of the immediacy of this moment.
Question came in, what is your recommendation for when babies should be allowed to meet extended family? Is there any guidance on that?
And that's a tough one. Babies, even not in a pandemic, we're very cautious with exposures to illness. And so I think now more than ever. And so I think you have to limit those exposures as much as you can. So what I'm sort of guiding my families on, initially I was pretty strict and I said 0, but then we started seeing maternal depression, postpartum depression rates skyrocket in those moms because they did not have the support that they needed. And so I think you do need to limit. I think that if you have a grandparent who wants to be involved in the care, they should quarantine for 2 weeks before the baby is born, if that's possible. They should wear a mask. They should wash their hands if they're going to, and try to social distance when they're around. But I do believe that it's similar to the school issue. Those moms need support so that they don't fight, a severe postpartum depression. And so limiting their risk in the safest possible way, but supporting them through what's a really challenging time with a newborn. I do not think you should have any sip and sees. I do not think you should have large gatherings at all. Very limited, small exposures, immediate grandparents only, just for the support of the parents.
Excellent. Excellent. So we had a question back to the schools. Somebody mentioned a while ago about super spreader events. And the question was, would a school with 1,000 students be a super spreader event?
Well, I think these are the discussions that people are having. How do we mitigate that risk? A super spreader tends to be just a random person who just as a super spreader and without knowing it. And so, yeah, I mean, that can happen. I think that at least some of the discussions that I've been sort of peripherally involved in, they're trying to be thoughtful about things like not doing choir, not doing, trying to minimize the groups that the kids, especially in the younger kids, it's easier to control, but minimize the number of other kids that they come into contact with. I think that's much harder in the high school level. How do you control the social interactions and the interactions between kids? But I think those are, I think Alice said early on, there are risks and benefits to all of it. And everybody has to understand with reopening schools comes risk. And all we can do is try and predict and minimize those types of risks.
So we're getting close to being done. I do want to ask one more question for Dr. Jones. And I'm going to put you on the spot here. You told me when I asked you to do this that you work primarily with children and adolescents, but yet despite that, I'm going to ask you to expand your area of comfort here, your area of expertise. I read recently that according to the CDC, 1/3 of the country recently reported experiencing depression or anxiety. 1/3 of the country recently. Last year in 2019, that was 11%. So what are some ways that we can cope with the stress and the isolation in the way that it's impacting our mental health?
Well, I completely agree. I think that anxiety has risen significantly, and certainly depression. And in some aspects, there's also some very expected and normal grief that's happening. We typically think of grief in response to a death loss, but we've all lost many things in the last 5 months. And I talk to children, but I know in adults too, we've all suffered significant losses, loss of security, loss of job, loss of structure, loss of loved ones if we can't go visit them and can't see them. The list goes on and on. And so I do think there's some acknowledgement of that grief that's important for people to give themselves a little space and forgiveness and grace to be able to take the time to grieve. I also think we have to, on a daily basis and hopefully multiple times a day, engage in some self-care activities. And that can be the basics of sleep and nutrition and exercise and trying to take care of our physical body. But I also think it's about reaching out to loved ones. I've heard some really inspiring stories over the last few months of people, their social group in some ways shrinking to those that are most important to them. And they may be finding that college roommate and talking to them now every day that lives across the country, and making the effort to do some things like that, I think are really good for self-care. I also think we all need to do a lot of listening to our loved ones and acknowledge their anxiety and try to hear them out, whether it's a tiny child that's worried or an older adult that's worried, and reaching out to neighbors. And I think we've got an opportunity to really be a community. And one of the things that I've talked to lots of families about is so much of this has made us feel powerless, that it would be great to think about the things we still have power to do. And we can still reach out to our neighbor to see if they're doing okay and do they need a grocery run. And we can still come up and volunteer and bring toiletries to the day resource center. We can do things like that we think, okay, I still have power to do these things. And that helps to balance that anxiety in lots of ways.
Excellent. That I'm gonna end on that. That was an excellent answer, and something that I think we can all take away from that. I want to close not with a question that came in, but a statement, and it said simply, "You all are my heroes. You are doing a terrific job with this panel, and we appreciate your taking your time on what must be a super busy and stressful professional lives." And I could not agree more. You all are doing such an amazing work, and we are so appreciative for you and for all of your colleagues that are out there on the front lines, doing this hard, dangerous work every day. And so we simply want to say thank you. And we are so fortunate to have such wisdom and such expertise in our congregation. We are truly blessed as a community of faith for your willingness to come be a part of this. And so I simply want to say thank you to all of you that have been on this panel, but also to all of you too who have tuned in tonight. I do hope and pray that this has been something that has been meaningful, that you have had some of your questions answered. I think we got to just about all of them. And if we didn't get to yours, I apologize. We were doing the best that we could. But simply say thank you. And as we sign off, I want to encourage you to wash your hands and to maintain your social distancing, and to do everything that we can, both as a congregation, as a community of faith, but also as community members, that we are all in this together. As I heard somebody say the other day, we're not all in the same boat, but we are all in the same storm. And so if we all do our part, we can get through this. We can and we will, through faith and through our best practices, we will get through this. So grace and peace. Thank you so much for being a part of this, and I wish you all well.